her MBBS from Kolkata National Medical College. She got her training in psychiatry from Nimhans, Bengal and Calcutta University. She is working at Monovikash Kendra Research and Rehabilitation Institute.
Sensory processing disorders in autism. And so why do we need to look into sensory processing disorders in autism? It's because there's a high prevalence of sensory symptoms ranging from 60 to 96% in children with autism spectrum. And we think that the sensory processing differences likely contribute to many of the higher order cognitive and social deficits of ASD. And it also has been seen that white matter pathways which are involved in processing sensation show decreased connectivity in multiple parieto-occipital tracts, the areas that handle basic sensory information in the posterior part of the brain, and also the inferior fronto-occipital fasciculi, the inferior longitudinal fasciculi, and the fusiform amygdala and fusiform hippocampus. All these tracts are critical for socio-emotional functioning, and these are the things that we see problematic in children and people on the spectrum. So now, what is sensory processing? Now, this concept was first brought on by Dr. Jane Ayers. She was an occupational therapist and an educational psychologist who worked with children, and she felt way back in the late 1960s and 70s that there was something wrong which contributed to the problem. So she came up with this concept of sensory processing. So what is it? So in sensory processing, we take in information from our surroundings, we interpret the information and develop a response to it. So we can also say that the sensory processing or sensory integration is a neurological process that occurs in all of us, and we constantly take in sensory information through our bodies from the world around us, and as our brains organize or integrate this sensory information, it becomes meaningful to us. So normal sensory integration allows us to respond to the specific sensory input we receive automatically, efficiently, and comfortably. So how do we, so what are the agents to which we take in the information? We have the familiar senses, the 5 familiar senses, which all of us know we studied in school. The auditory sense, the perception of what one hears, information from your ears. The gustatory, perception of taste, texture, temperature, and flavors, information through the mouth. Olfactory, perception of what one smells, information received through the nose. Vision, perception of what you see, information through the eyes. The tactile, the touch sense, information received through the hands and the skin. And then we have the 2 hidden senses that respond to sensory input that is inside the body. So what they also call the power senses. It is the proprioceptive system. So muscles, joints, and tendons provide the person with a subconscious awareness of the body position via the feedback from receptors in the muscles, tendons, and joints. And what do we use the proprioceptive system for? We use it for motor planning, and we use it for awareness of the body in time and space without constantly visually monitoring. And then we have the power sense, also the other one, that is the vestibular system. The vestibular system refers to the structures within the inner ear, the semicircular canals, and these structures detect movements and changes in the position of the head. And the brain needs the vestibular input in order to function. So what are the impact of the hidden senses? We are not consciously aware of the hidden senses. We cannot control them and we cannot see them. But along with the tactile system, these 2 hidden senses are fundamental in laying the groundwork for a child's healthy development. When the hidden senses operate automatically and efficiently, a child is able to focus his eyes, ears, and attention to the task at hand. So now, we'll briefly look at the 4 levels of sensory integration because these are the levels which are affected in people who belong to the spectrum. So the first is level 1, where the primary sensory systems, by the age of 2 months, the tactile sense, the vestibular sense, the proprioceptive sense are all developed. By the age of 1 year, that is the perceptual motor foundations are laid down. So the body awareness comes into being, the bilateral coordination and lateralization, hand preferences, and motor planning or praxis. Level 3, by the age of 3 years, auditory perception, visual perception, eye-hand coordination, the pencil skills, visual, motor integration, purposeful activity. Now, these are the areas which are often, many of these areas are often affected in children who belong to the spectrum. And usually when they come to school in the kindergarten, that is when all the complaints start coming, that the child is not holding the pencil, he's not writing, he's moving, moving out of the classroom, he's not sitting. And in level 4 is the academic readiness by 6 years. So you attain the academic skills, complex motor skills, regulation of attention, organized behavior, specialization of body and brain visualization, and self-esteem and self-control. So this is just the 3 parts of the sensory processing. There's the input from our senses, the integration in the central nervous system, and the output. The result is the adaptive response, the learning process. So what is sensory integration dysfunction or sensory processing dysfunction? It is the inability to take in, organize, and respond to sensory information in a meaningful and appropriate way. So the sensory processing disorder can be visualized in these kind of 3 domains: sensory motor responsivity, under-responsivity, or sensory seeking, sensory-based motor disorder, postural disorder, dyspraxia, and the sensory discrimination disorder, which affects all the different senses. So what does a dysfunction look like? It affects arousal, alertness, self-regulation. Some people are oversensitive, some are unresponsive, while others are under-responsive. So everyone processes sensory input differently, and that's okay. Like, we all have our sensory preferences. But what matters is when the sensory input is negatively impacting the child's or the individual's life and causing problems. So when the sensory processing goes astray, what does it look like? Struggles to stay alert or awake, or overtly alert, unable to attend, delays in processing and shifting attention, or cannot stay focused and the attention shifts continuously. Unable to touch many items, they're picky eaters, or they explore the environment by touching everything. And so these are the review of some of the other characteristics: slow processing, inattentive, does not like changes of transitions, very common in children, people in the spectrum, rigid, difficulty with or seeks out certain types of food or textures. Food fads are very common in them. They don't like eating many things. They eat certain things which are not supposed to eat. They smell food all the time before eating, unable to sit with anyone behind them in class. The teacher will always complain, oh, this fellow is very disobedient, he's, he's disturbing the other children, and, he's always, we have to throw him out of class because he disrupts the whole class. Difficulty attending from the back of the room, and explosive emotions or lack of emotions or incongruent emotional responses. Suddenly may start crying, may start shouting. Aggression to self or others, compulsive behavior. Difficulty with clothing. This is very common. Type of clothing and change of clothing. They wouldn't like to wear certain textures of clothes. So there is a story about Temple Grandin when she says that when she was small, she didn't like going to church because they would be wearing those starch clothes, and that would make her uncomfortable, and she would cry all the time. So, so this is all due to her sensory sensitivity. And perseveration on topic or activity, fixation on sensory stimuli. Some of them like toys which emit light, some they like toys which spin, and they like colorful toys, or they like bits of strings or silver paper or all odd things. So now we'll come to the subtypes of sensory modulation disorder. When sensory over-responsivity, too much information is coming in. Sensory under-responsivity, information comes in but not responsive to it. And sensory seeking or craving, needing more information. So what does it look like, sensory over-responsivity? The brain has a low threshold. So tactile, they'll have difficulty with getting haircuts, cutting nails, avoidance of touching certain textures, vestibular, disoriented after bending down, anxious when feet leaves the ground, avoids rapid or rotating movements, and visual, difficulty tolerating bright lights. Proprioception, difficulty being hugged, difficulty with people moving your body, auditory, fearful of sounds, very common. They don't like the sound of pressure cookers or motorbikes or the mixie grinders. Distracted by certain noises, frequently covers ears. Oral, picky eater, difficulty brushing teeth. That is a very, very common disorder. The parents will say, my child doesn't brush his teeth. He throws a big tantrum. And even there are children who are older who would be going to school without brushing their teeth because they don't like the feel of brush in the mouth. So sensory under-responsivity, brain has too high a threshold. So tactile, difficulty noticing touch, dresses inappropriately for weather. It's very cold, the child does not want to wear anything. Vestibular, does not get dizzy, enjoys being upside down or sideways, thrill seeker. The child is climbing up the wall, he's climbing on the grills. Mother doesn't know how to manage him. Visual, often misses what is right in front of him. Sensory under-responsivity, proprioception, poor body awareness, floppy or poor posture. Auditory, listens to loud music on TV, talks to self during a task out loud. But this is very common. We always see some autistic people who just keep talking all the time. Oral, may be able to eat anything. No, I mean, not eat anything. They'll be putting a lot of things into the mouth and, and sometimes they would be eating things which they're not supposed to eat. Then you have the sensory seeking or the craving. They seek arousal of the nervous system inappropriately. So tactile, enjoy bear hugs, crave touch of textures, vestibular, jumping, enjoying spinning in circles, being upside down. Proprioception, loves crashing or bumping into objects, craves highly physical activities. These are the children who get into trouble in school all the time for being mischief mongers. Auditory, speaks louder than necessary, needs to listen to music to concentrate. So this is also one of the very common problems. The mother, I had a child who the mother said he would only do the task if the music was on. If the music was not on, he would not do the task, and he needed only one particular tune. If the tune changed, he would throw a fit. Oral, puts anything in the mouth. And then we have the examples of dyspraxia, which are very common, like poor gross motor skills and poor fine motor skills are very common in them. They don't know how to put on the buttons, they don't know how to tie their shoelaces. Problems in figuring out how to do movements. Now there was this little boy who was verbal and he was quite good in studies, but his mother came to me saying he plays the fool in the yoga class. He does not do what they tell him to do, yoga and karate. So he just doesn't do what they tell him to do, and I think he's not so dumb because he's good in studies. So I took the boy aside and I asked him, what is your problem? And he says, you know, I go to the class, I see the instructor doing it, but I don't know where to put my hands. I try to put it, but I don't. So this is the child who's having dyspraxic problems. Proprioception, poor motor control and body awareness during dressing, vision, navigating through problems navigating through crowded hallways. So a seeker and an active avoider can appear similarly because both may move frequently. Seekers are looking for the stimulation while avoiders are attempting to escape the stimulation. Now, under-responder and an overwhelmed can also have some similarities because may not appear sensory needy as a seeker or avoider, but overwhelmed or vigilant and will have anxiety to the environment and will resist change. And the responders also may not respond to environmental cues, however, due to lack of awareness and vigilance. So now let's take a summary of the processing challenges. We have the seeker who has a heightened awareness with low sensitivity to stimulation and will seek out input. The active avoider, high awareness with high sensitivity and active responses, will actively avoid. Overwhelmed, heightened awareness, heightened sensitivity, but lacks active response, can become easily overwhelmed, complains of things bothering, frequently anxious, upset, reacts to small changes in the environment. Under-responder, poor awareness and low sensitivity to stimulation, misses environmental cues, slow processing, acts as if he does not hear, misses gestures and cues, and sedentary. You know, the mother may say, oh, the child is so lazy, he doesn't do anything, whole day he sits, he just plays on the tablet, or he plays games on the mobile. So like all children are playing games on the mobile these days. That's the biggest toy. So what can we do about these things? We prescribe the sensory diet. And what is the sensory diet? It is providing sensory experiences and making environmental modifications. So what do? We do an informal assessment. The best thing is to take a detailed history from the caregiver. So, and then we have to decide whether he's a seeker, an active avoider, an under-responder, or an overwhelmed. And then we have to provide him the necessary things. Like if he's a seeker, you provide sensory experiences frequently and proactively. But you may need to limit the excited experiences. If he's an active avoider, modify the environment to reduce the need to escape and gently introduce him to new experiences. And if he's overwhelmed, control the environment, limit stimulation, limit change, but prepare for changes when they need to occur. Under-responder, increase the use of visual supports and routines, structure the environment, the time to respond, careful encouragement to try new experiences. So, I mean, we use a lot of things. So, these are some of the things we use, you know, swings, rocking chair, sit and spin dizzy discs for children with vestibular problems. Then we have the therapy balls. We use it for tactile, and then we have the movable cushions and beaches. And other tactile supports are these little balls, which we call fidget balls. It helps them. And also for people with tactile difficulties, we have these heavy blankets. I don't have a pointer, but you know, it's okay. It's all right. I mean, you can see it. Good. Is it working? So you have these heavy blankets. This is for children with tactile problems, and also this on the lap for, you know, the child may be fidgety, may be moving about, but if he has a tactile problem, if you have to give him this, he'll be much manageable. And this is very important because a lot of children on the spectrum refuse to write, and these things do help them. So, because, you know, frequently the parents will tell you, the mother, that if I hold on to his hand, you know, he's just right. So this kind of thing, this pencil grips, it kind of helps them. I don't ask him how it helps, but it does help them. Not available over here. Not that maybe in Flipkart, I have not seen it, but it does help. So what do we expect after, you know, we've given them the sensory diet? We expect them to be more alert, more tuned in, able to respond more quickly, able to focus on tasks, able to attend for longer periods, less explosive or unpredictable, calmer, more interactive, less stressed. The reason why I chose to speak on sensory processing disorders is because I think we have to shift a little bit away from prescribing medications to children on the spectrum on the first go. I mean, I think there is a lot of tendency to prescribe medications, especially very young children, and all of them do have sensory problems. So I always, in our clinic, we always start with these behavioral methods first, and if the child is very, very unmanageable, we go for medications like risperidone and the usual. But usually we don't like to use too much of medications, because I'm not saying medications are bad, because I think that if we start with the behavioral methods, it helps them. And if we give medications, the parents tend to rely on it and not do much of the behavioral methods. And we do know that for people on the spectrum, routine and behavioral methods a lot, like social stories, social narratives, priming the child before going. So all
another 1 minute, ma'am.
Yeah.